Today we're going to be working on the sagittal plane of motion. You will need your physioball, a cable attached to the wall at mid-chest level, a TRX, and a pair of dumbbells. Each movement is going to be 1 minute long. Our segment is 5 minutes total. The first thing that we're going to do is we're going to get onto our TRX. We're going to get into a plank position, and we're going to hold the handles, both of them, in one hand. We're going to get into a plank position, and we're going to drop, pull ourselves up, and drop, pull ourselves back up. Keep that plank position, and when you're pivoting, we're going to pivot from the chest. Are you ready? We have 1 minute. Here we go. Control your body on coming up and coming down. If you need more attention, step further towards your wall. Try to keep your hips as straight as possible and only pivot from the belly button. So we're working on the transversal plane of motion, obliques, transverse abdominis, and the entire upper body complex. Everything that we're doing in this segment has a twist to it, so make sure that you're not forcing your range of motion. And if your back starts to feel overly worked, stop. You will probably be sore in your lower back the next couple days. That's because you're working it. Sit your TRX down. We're going to pick up our free weights, and we're going to go into a bent over row twist. So we're going to be here. Pivot only from the rib cage. Keep the waist stable, so we want even pressure on our heels. We're using our monkey toe. We're pulling straight back with the elbows, so our shoulders do not come up to our ears. Keep your duck butt position. No movement through the knees. So if you're feeling your knees starting to hurt on the inside, you're dropping your knees in. Make sure that your legs have no movement. We're only bringing the elbow up at an angle, and we're pivoting from the rib cage. Keep going, very nice. You have 10 seconds on the clock. Set your weights down, and now we're going to go into our functional movement, a curtsy. So we're going to come to the side, back center, to the other side. Are you ready? Here we go. Keep your chest up all times. And modify your range of motion because we don't want to have any knee pain. So however your body feels most comfortable in the movement, that's how you're going to do it. Again, you are not going to be on the toes of the leading leg. You want to have all of your pressure point on heel. Do not lean forward. Make sure that your chest is staying straight up and down. Shoulders are down. We have 5 seconds on the clock. Very nice. Now we need to go to our cables. Make sure they are securely closed in the door. We're going to step back, and we're going to go into a wide row twist. Keep even pressure on your heels, shoulders down, chest up, and we're pivoting only from the rib cage again. The hips are not moving. If you need more tension, step away from your wall. If you need less, step towards your point of origin. Keep your chest up, chin up, and pull your elbows slightly towards the floor. That'll minimize any shoulders coming to your ears. Make sure you're not leaning. You have even pressure on both heels. And use your monkey toe technique so you don't pitch forward. Pull elbows down. Make sure your shoulders are not coming into your ears. Keep going. We have 10 seconds on the clock. 5. Beautiful. Set your cables down. And our last movement is going to be on the ball. We're going to sit back on our ball and we're going to go into an alternate arm arrow. Make sure the ball does not move. Chest up. We're pushing the middle of our lower back into the ball. And we're going to pivot to the right and to the left. Make sure we're not bouncing and that our knees are not moving. The only thing that's moving is our upper body. Elbows are coming out at a slight angle towards the floor. Shoulders should not be coming up to your ears. And you shouldn't be sliding around. And you don't have far to fall, so don't worry. Make sure you have your ab shoes on. Or if you keep sliding around, place your feet against a wall or a piece of stable furniture. Remember, if your back starts to feel overly tight, stop. And that's the end of the first segment. See you soon.